So I'm here today with Schall, who's the head of the Caregiver Action Network, and Jim Cavan, who's the head of Backpack Health. John, let's talk a little bit about what makes you so excited about this new tool.
And excited we are. As the national nonprofit in the family caregiving space, Caregiver Action Network, we do lots of partnerships, companies, organizations, hospital systems. But we are really excited about this new partnership with Backpack Health.
As are we.
Good, I'm glad to hear. This tool that Backpack Health put together, I think, can be a genuine game changer for those tens of millions of family caregivers across the country. It's a way to put in one place, virtually, in a virtual backpack, all the information and help data that you need for your loved one, and to be able to share it, kind of instantaneously and easily. I have to tell you, I use it myself. I'm a caregiver for my mother. I'm in DC, she lives in Michigan. Sometimes I do her doctor's appointments with her, that change medications. I can put it in backpack, share it with my sisters instantaneously. They're up in Michigan, so they know. It just makes it easier from that family caregiver standpoint. And not only easier, but I think in some cases, this really can be a difference between life and death. And I think that's why we're so excited about this new tool that Backpack Health has put together.
So Jim, this tool is free? How is that possible?
This tool is free to patients and their families. You can have as many dependents, either children or elderly parents, in your Backpack account as you wish. You can link your account to any other caregivers who are appropriate for the care situation that you're seeking to support. Backpack is designed to support and be there for patients living with complex health conditions and for their family caregivers. We're so excited about the relationship with the Caregiver Action Network, the opportunity to have a dedicated environment within the Backpack platform that is able to provide educational information and more resources to help the family caregiver, regardless of what your clinical condition may be. That's just a wonderful resource. We could make it available in all 6 of our functional languages, and it will give us for the first time the opportunity to work with the Caregiver Action Network and collect meaningful information consented by the patient family caregivers about the burdens of family caregiving to help make decisions going forward with the types of resources that need to be made available, the types of programs that need to help, and really be there for a real resource.
Absolutely. So, to that degree, let's talk about impact, right? How many caregivers are there in the United States? I feel like a lot of people don't even talk about being a caregiver.
Oh, very true. There are 90 million family caregivers in the United States. 2 out of every 5 adults are some family caregiving situation. But family caregivers don't tend to think of themselves that way. If I'm caring for someone with Alzheimer's, I'll go online, I'll learn everything there is to know about Alzheimer's. But I don't think to Google, is there help for me as a family caregiver caring for someone with Alzheimer's? So they don't really think of it that way. And that's why, even though there are so many millions of us, frankly, there's a real data gap about who we are, what we need, the challenges that we face. Some of that demographic information we collect as can. But I think one of the huge powers of Backpack Health is that behind this wonderful, useful tool for family caregivers and patients to use is this ability to collect data so that we really can see in macro form types of challenges that people are looking at, and finally give us a database where we can get some very useful information.
Jim, what's the potential for the observational research here?
Observational research and patient-reported or family member-reported outcomes, the opportunity is virtually limitless. As technology improves our ability to consent individuals online and with the support of an institutional review board to do it ethically, to do it functionally and with minimal impact on the patient or their family caregiver's lives, it's there. We can link to a variety of either medical record sources or wearable devices, so the types and the breadth of information is very much multimodal. Because we're able to do it across our 6 languages, it brings us multinationally very quickly, and because those languages are homogeneous, meaning that a term in English means the same as the term in Italian, we can commingle that data for the first time and have it be very dynamic and take the opportunity to not just capture all from a group here in the United States, but right now Backpack's functioning in 80 countries around the world. That's an awful lot of data we can make available to John and the Caregiver Action Network researchers, just as we do to researchers for rare and complex health conditions.
So Caregiver Action Network, as great a partnership as it is not your only partnership. Do you want to talk a little bit about other partnerships you've got going?
Well, terrific question. We're very proud. Our primary relationships are with medical foundations. We have some very strong and established relationships, the Marfan Foundation and other groups across, as we have about 25 right now, different foundations we work with, both here in the United States and outside the United States. We're focusing for the time being on small and rare conditions because these are communities that really can benefit, and then it allows us as a company to really get a good foundation and a good stable base of users. And that's going very well. We're very, very pleased with the support that we have. I'm very proud of my team. We have a very busy, very dedicated group of people who are handling a rapidly growing backlog of requests to be part of the Backpack platform.
So I know that this would have made a really big difference for me as I was caring for my dad, because when I took over his care, I had no idea what drugs he was on. I had to go to 3 different doctors to figure out his dosages. But there's another really fascinating use case, and that is if there's an emergency, right? Like there might be some way to alert emergency responders of what's going on.
Yeah, absolutely. This is an area near and dear to my heart. My clinical training and my first career was in emergency medicine. Backpack, since we capture all of the information that's important in a patient's life, we can make it available at the time of most need. So I'm very proud of our emergency share card structures. Those share cards are secure. They can be shared willingly to a babysitter or a bystander if you happen to be there. If you can speak for yourself, you can easily share your information. It's complete and up to date as your record is kept up to date. It's not something that becomes stale. That emergency information is completely translatable. If you happen to be traveling to another country, you can translate it on the fly into any one of our multiple languages. Mm-hmm. But that share card can also be connected to, say, a loved one's phone or account, so they have access to it. But it can be connected as well to medical jewelry. So if you put the secure URL and passcode on the back of a medical bracelet or necklace, and someone finds it, even if you can't speak for yourself, Backpack can speak for you, and it will open and function in any of the languages that it needs to.
Well, so let's do a use case. It can have an impact on, let's say, a patient who might not be able to speak for themselves, might give instructions for DNRs, do not resuscitate, things like that.
Correct.
But it also could impact a caregiver who, let's say, might be caring for somebody critically ill at home and might get into an accident.
Right, so this is where the Caregiver Action Network's given us such great insight into the struggles and the pressures of family caregiver. So one of the things we've done as we've moved forward in this partnership with them is we've built out an area so that if there is information about an individual, maybe as a caregiver for someone else, whether it's a person, maybe it's even a pet, you can indicate that there's someone waiting for me at home, or if I can't be there, someone needs to go check on this person. What is that? That's a great peace of mind for that individual to know that if something happens to them that is beyond their control, that someone will at least be told, go take care of my obligation. So we're very proud of that.
Yeah.
That was a wonderful feedback.
It's a big deal. I mean, think of it. You're at work, right? Let's say you have a spouse at home with MS, many, many years. Maybe there's a paid in-home caregiver, but that healthcare worker leaves at 3 o'clock. You're driving home from work, you get into an accident, now you're in the hospital, right? Now all of a sudden, that hospital staff can know that your loved one with multiple sclerosis is home alone, and someone can follow up on that. You know, it sounds like such a simple thing, but those things weigh on your mind so heavily as a family caregiver. Mm-hmm. And that's why this is hugely powerful, both from the individual standpoint, but really population-wide, because now look at it. Now with the data, now we'll be able to figure out how often that kind of thing happens. Mm-hmm. If you're a hospital system, by looking at some of this data, now we can figure out which interventions are actually working with family caregivers, hugely powerful.
Yes.
If you're a pharmaceutical company, now we have data on a particular disease state, so patients and family caregivers in that disease state. So if we want to ask them questions about what may help them, work with a particular disease condition, that's hugely important data from a pharmaceutical company perspective. I mean, this is just sitting on an absolute powder cake of
Could not
powerful
agree more.
data. So,
And it's data that hasn't been traditionally accessed in any way. It's almost like the untapped pool of insight. It's no one's ever thought. So
Yeah.
I'm excited.
It's amazing that both micro and macro impacts of the potential for this tool seems huge for the 90 million caregivers in America. So amazing. Congratulations.
Thank you very much. Thank you both.
thank you. Thanks.
Thank you.